Deborah Gatewood, a longtime employee here at Beaumont, Farmington Hills, of course, came here when she started to feel those COVID-19-like symptoms. She was turned away, sent home 4 times. Her family truly believes if she was admitted and taken seriously, she'd be alive today. 31 years, Deborah Gatewood wore the Beaumont badge, doing blood draws at the Farmington Hills Hospital. So in the 3rd week of March, when she got the infamous cough and fever, it's where she turned.
And they sent her home saying, you are showing signs of COVID. So they were confirming that she probably most likely has COVID, but they didn't test her.
Her daughter Kayla marked in a calendar the days her mom went to ER.
She actually went that Monday.
She says her mom was sent home 4 times, once with cough medicine, each time told to rest. The fever got higher and symptoms worse.
The fact that she got infected doing the job that she loved doing for 31 years and she couldn't get taken care of by her own family, that being Beaumont, is just sad. It's disheartening, to say the least.
By the end of March, she withered away, developing bilateral pneumonia.
So all of this time where you're telling her to go home and rest it off, how do you really rest off bilateral pneumonia, without any type of treatment other than cough medicine to try and cough it out? It's too severe at this point.
Deborah collapsed and was taken by ambulance to the nearest hospital, Sinai Grace. At that point, inundated and understaffed, it's where she'd spend her final days.
I just went up to the hospital, sat in the parking lot. Just if this is as close as I can be to her, if this is going to happen, I'm going to sit in my car until I get that phone call.
This only child said goodbye to her 63-year-old mother, 2 years from retiring when she'd be a full-time grandma.
So she said, I'm hanging there for a couple more years. And she said she's going to retire, and then she was going to be the greatest grandmother nanny that I needed her to be to take care of my daughters.
It was a different point in the pandemic a month ago when Deborah first went to Beaumont's ER. We asked the hospital what their protocol is now for admitting people. This was the response. As patients come to Beaumont for care during this pandemic, we are doing everything we can to evaluate, triage, and care for patients based on the information we know at the time. We grieve the loss of any patient to COVID-19 or any other illness. Last night on The Edge, we shared a very similar story to this one. A father and son turned away at multiple Metro Detroit hospitals. Sadly, they both passed. After that story aired, we received many messages from people all over saying this happened to them or their loved one. This is definitely not isolated to Beaumont Health. Live in Farmington Hills, Jessica Dupnack, Fox 2 News.
Jessica, this is a difficult situation for the patients, their families, and for healthcare professionals too. That's why they call it the novel coronavirus. Doctors haven't seen it before, and with both the diagnosis and the treatment, they are not as precise as we would like them to be.
Absolutely, and it's really a moving target. It's a different world a month ago than it is today. And we did ask Beaumont to highlight their protocol. How are they admitting people? They wouldn't get into the specifics. They said they're taking it right now at this point today on a case-by-case basis.